Hello everybody, I hope you are in good condition and remain at home to prevent the spread of the coronavirus that is happening right now. Okay, before I explain about the topic, I will introduce myself. My full name is R.Helmon. I am a student at Indonesian Catholic University St.Paulus Ruteng, especially in English study programs. Okay, now I want to explain about the coronavirus. Sadly, we all know about the coronavirus that is being spread throughout the world today, especially those that attack our country. Therefore, at this time, I will discuss about the coronavirus. Before I explain about this virus, we must know what is a coronavirus, causes of coronavirus, coronavirus diagnosis, symptoms of coronavirus, coronavirus treatment, and the last is coronavirus prevention. Let's get started. Coronavirus infection is called COVID-19 or coronavirus disease 2019 and was first discovered in the city of Wuhan, China at the end of December 2019. The virus is transmitted very quickly and has spread to almost all countries, including Indonesia, in just a few months. Coronavirus is a collection of viruses that can infect the respiratory system. In many cases, this virus only causes mild respiratory infections such as flu. However, this virus can also cause severe respiratory infections such as lung infections or pneumonia. Let's start with the word outbreak, epidemic, and pandemic. These three terms are often used when discussing about COVID-19. And the first, I will explain about the outbreak. Outbreaks are an increase in the incidence of disease that exceeds normal expectations suddenly in a community limited by a certain place and time period. And the second, explains about the epidemics. Epidemics are defined as epidemics that occur in large geographical areas and affects a large part of the population. And the third is a pandemic. Pandemic is an epidemic that has spread across countries or continents, usually affects a large number of people. This makes some countries implement plans to impose lockdowns in order to prevent the spread of coronavirus. In Indonesia itself, large-scale social restrictions or PSBB plans was put in place to suppress the spread of this virus. Okay, and now I will explain about the causes of coronavirus. Coronavirus infections or COVID-19 is caused by coronavirus, which is a group of viruses that infect the respiratory system. In most cases, coronavirus only causes mild to moderate respiratory infections such as flu. However, this virus can also cause severe respiratory infections such as pneumonia, middle-age respiratory syndromes, and severe acute respiratory syndrome. It is suspected that the coronavirus was initially transmitted from animals to humans. However, it was later discovered that the coronavirus was also transmitted from human to human. A person can get COVID-19 through a variety of ways, namely, suddenly inhaling solid sprays or droplets that come out when COVID-19 sufferers cough or sneeze. holding the mouth or nose without washing hands first after touching an object affected by saliva sprays of people with COVID-19. Close contact with people with COVID-19 coronavirus can infect anyone, but the effect will be more dangerous or even fatal if it occurs in elderly people, pregnant women, people who have certain diseases, smokers, or people whose immune system are weak. For example, in cancer patients. Because it is easily transmitted, the coronavirus is also at high risk of infecting medical staff treating patients with COVID-19. Therefore, medical persons and people who have contact with COVID-19 patients need to use personal protective equipment or PPE. And now I will explain about coronavirus diagnosis. To determine whether the patient is infected with the coronavirus, the doctor will ask about the symptoms experienced by the patient and whether the patient has just traveled or lived in an area that has a case of coronavirus infections before symptoms appear. The doctor will also ask if the patient has any contact with someone who is suffering or is suspected of having COVID-19. To confirm the diagnosis of COVID-19, the doctor will carry out the following tests. One is rapid test that detects antibody produced by the body to fight the coronavirus. The second is swab test or PCR or polymerase chain reactions test to detect coronavirus in sputum. And third is CT scan or chest X-ray to detect infiltrates or fluid in the lungs. And for a positive COVID-19 rapid test, it's more likely to indicate that you have indeed been infected with the coronavirus, but it could also mean you are infected with a germ or another virus. Conversely, a negative COVID-19 rapid test result does not necessarily indicate that you are absolutely free of the coronavirus. And now, you must know about the symptoms of coronavirus. Early symptoms of coronavirus infections or COVID-19 can resemble flu symptoms, namely fever, runny nose, dry cough, sore throat, and headache. After that, symptoms can disappear and heal or even aggravate. Patients with severe symptoms can experience high fever, cough with pain, and even bleeding, shortness of breath, and chest pain. The symptoms appear when the body reacts against the coronavirus. In general, there are three general symptoms that can indicate someone is infected with the coronavirus, namely fever, body temperature about 38 degrees Celsius, dry cough, hard to breathe. There are several other symptoms that can also appear in coronavirus infections, also more rarely, namely diarrhea, headaches, conjunctivitis, loss of ability, taste or smell, rashes on the skin. The symptoms of COVID-19 generally appear with 2 days to 2 weeks after a patient is exposed to the coronavirus. Now I will explain about a coronavirus treatment. Coronavirus infections or COVID-19 cannot be treated, but there are some steps the doctor can take to reduce symptoms and prevent the spread of the virus, namely referring patients with severe COVID-19 to undergo treatment and quarantine in a referral hospital, provide a fever and pain reliever that is safe and appropriate to the patient condition, encourage sufferers of COVID-19 to the independent isolation and adequate rest, require sufferers of COVID-19 to drink lots of water to maintain body fluid levels. And now I will expand about coronavirus prevention. Until now, there is no vaccine to prevent coronavirus infections or COVID-19. Therefore, the best prevention method is to avoid the factor that can cause you to be infected with the virus, namely physical distancing, which is to maintain a minimum distance of 1 meter from other people and not to leave the house unless there is an urgent need. Second is use a mask when doing activity in public place or crowds, including when you go shopping for groceries. And third, routinely wash hands with soap and water or hand sanitizer containing at least 60% alcohol, especially after doing activities outside the home or in public place. Do not touch the eyes, mouth, and nose before washing hands. In case injuries, avoid contact with people with COVID-19, people suspected of being positively infected by the coronavirus, or people who have a fever, cough, or runny nose. Cover mouth and nose with tissue when coughing or sneezing, then throw the tissue in the trash. Keep clean objects that are often touched and environmental cleanliness, including cleaning the house. For people suspected of being affected by COVID-19 are included in the ODP or monitored person or PDP or patient under surveillance category. There are steps that can be taken so that the coronavirus is not transmitted to others, namely to independent isolation by staying apart from other people for a while. If it is not possible, use a bathroom and bathroom that is different from what others use. Do not leave the house except for treatment. If you want to go to the hospital when the symptoms get worse, you should first contact the hospital to pick up. Forbid others to visit or visit you until you are completely healed. As much as possible, do not meet with people who are sick. Avoid sharing that use of eating and drinking utensils, toiletries, and sleeping equipment with others. Wear a mask and gloves when in a public place or with someone else. Use tissue to cover your mouth and nose when coughing or sneezing, then immediately throw the tissue in the trash. Conditions that require direct treatment by a doctor in the hospital, such as childbirth, surgery, dialysis, or vaccination of children, need to be treated differently with some adjustment during the COVID-19 pandemic. The aim is to prevent transmissions of the coronavirus while you are in the hospital. Consult with your doctor about the best course of action that needs to be done. Okay, I think that's all about this topic, and thank you very much for your attention. See you in the next video.